exchange communication system. So it was developed by Andrew Bondi and Lori Frost, who had doctorate degrees and master's degrees in the field, and it was developed in 1985. So it is generally used for kids on the autism spectrum disorder and nonverbal kids, and it was first utilized by Delaware Autistic Program. So what happens during PECS is an identical image of a desired item is given to a communicative partner who then gives you the item that is shown in the image. And then as you move on to the higher stages, it turns into sentences and making requests and full thoughts. And then individuals are taught to answer questions and make comments regarding that. So PECS is a teaching protocol that is based on Skinner's book, Verbal Behavior, and prompting and reinforcement strategies are basically used to encourage long-term communication in nonverbal kids. So those with cognitive deficits, physical and communicative difficulties. And verbal prompts are not used during this voice output system. So in other words, you don't give them cues to go on to the next step. And there are 6 phases in the PECS program. So the first phase is called how to communicate, and this is when the child is prompted by adult 1 to pick up the picture symbol and hand it to the other adult who is holding the desirable item. So 2 adults are involved in this stage, and this is the preliminary stage, so a lot of support is provided. The child is shown the direction of the adult holding the desired item, and so a lot of hand-over-hand support for this phase. And in the video, on the next slide, you will see an example of phase 1. So as you saw in this video, this is an example of phase 1 PECS or level 1 PECS. And here the symbol is placed right in front of the child, and the desired item, which in this case is the book, is also inside of the child and within close proximity for the child to be able to reach for it. So adult 1 is showing the child the symbol, and adult 2 is holding the item. And so the child is prompted to hand the symbol to the adult to get the item in exchange. Phase 2 is known as distance and persistence. So during this stage, the intent of the communicator is clearer because he has to reach for the item in sight, which is farther in distance from him or her. And the symbol is still in close proximity, and the child is prompted to reach for the symbol and pass it to the person holding the desired item. And during this phase, 1 item is still being used, 1 desirable item is just farther away. And in the next slide, you'll see a video of this demonstration. So this is phase 2 of PECS. Here you'll see adult 2 is standing instead of sitting this time, so farther away from the child. The child has to look for the adult holding the desired item. So it's more physically challenging for the child, also mentally challenging because now they have to kind of challenge their minds and see where the item is in proximity to them. So by phase 3, the child will be provided with 2 picture symbols, and usually it's a non-desirable and a desirable item to really test the child's intent of communication. So the child will need to hand 1 item or 1 picture symbol to the adult holding the item. And other factors are usually adjusted during this period or phase, such as the distance between the child and the item, or the child and the adult, or the distance between the child and the symbol as well. So symbol recognition is really assessed during this phase. So in this video, you'll see there are two picture symbols, but one desired item, and the other one presented in this video was a non-desirable item in the picture symbol, and the child had to look for the correct symbol to get what she wanted. So phase 4 is called sentence structure, and it's a formation of simple sentences using picture symbols. So now we're making phrases such as I want more from like a textbook. So maybe I want blank. I want a desired item. And the child here takes a sentence strip and places the phrase I want going with his or her desired item. And hand-over-hand support is usually also provided at phase 4 if needed, but it should be fading at this point, and depending on the needs of the child. And he takes the whole sentence strip and hands it to the adult holding the desired item. And depending on the child's level of functioning, adjective, verb, and or prepositions are often added. So maybe I want blue car instead of just car. So here you'll see that the child takes the phrase I want and the desired item and hands the whole sentence strip to the adult holding the item. And very little prompting was required here, so I think adult 2 did not provide any cues at all. Phase 5 is called answering questions, and during this phase, the child responds to questions such as, what do you want? What do you need? What do you want to eat? And by then, they'll have their own independent textbook with pictures where they'll be able to flip through and find the desirable items. And here, single pictures are totally acceptable, so they don't need to make a whole screen. The point is to get their intention across. And by this stage, a lot of kids actually graduate to being verbal or different AAC device, maybe a voice output device like the Quick Talker or a step-by-step. So it's pretty advanced. So you will see in the video, adult 1 asks, what do you want? And the child makes a sentence strip and says, book. I want book. So some kids will do just book. Some kids will do I want book, depending on their level. And no cues are provided, but some reinforcement towards the end. So you'll see adult 1 is repeating, oh, you want book, just to reinforce the verbal cues, because the more we give them, the more they're able to process and therefore produce. The last phase is called commenting. So at this point, kids are responding to more abstract questions like, what do you see? What do you hear? What is it? So they kind of have to be aware of their environment and process the questions. So they're simple WH questions. And they form sentences with I see, I hear, I feel, it is. So preliminary phrases are provided, and they kind of fill in the blank from their sentence strip. And the intent of communication is the highest at this stage, because not always is it a desirable item. Sometimes it's just a question that's being asked by an adult. So the motivation may not always be there. If a child is responding to text at this phase, it's because he or she has really understood the concept of it.
Me too.
So you'll see in this video, there was a sentence strip already with I see, and then adult 1 asked, what do you see? And the child filled in the blank, saying I see book, which was the item in sight. Now, it could be anything. If the communication being taken place between the adult and the child is about a certain toy. It could be about that toy as long as it makes sense and is true to the situation. So the following slides are just a few research articles that address the effectiveness of text in nonverbal children. So this article by Woodruff, Moore, and Cardy tell us that 20 to 61% of children with autism will use little to none functional speech to communicate. So a lot of their speech is nonverbal, just body language and gestures. And previous studies show that some children actually post-PECS go on to develop functional speech. And it still remains unclear as to why certain children develop functional verbal abilities and others do not. So the purpose of this study was to measure changes in speech production in children pre and post-PECS to compare the differences in their adaptive functioning abilities, symbolic representation, motor imitation, and receptive and expressive language skills. So through male children with autism ages 2 to 3 were studied, and their baseline speech skills were assessed. So their parents, during the experiment, were trained to use PECS with their children during weekly clinic and home visits for 5 months. Post-intervention data compared to pre-intervention data, and it was seen that imitation was the only area where the participants differed in skill level. Participant 3 was a recipient of PECS, demonstrated higher motor and verbal scores, and results showed that stronger imitation skills may increase functional speech after PECS use in individuals with autism. So participant 3 actually received the most amount of PECS training. Their parents received the most amount of PECS training, and therefore PECS was done with participant 3 the most, showing higher motor and verbal imitation scores. So research article 2 actually explored the relationship between PECS training and vocalizations in children with limited verbal ability. So children who are unable to verbalize simple phrases. So study 1 used a multiple baseline design across children to see the vocalizations of 4 children with autism during and after PECS training. And the results of study 1 showed that 3 of the participants demonstrated higher frequency verbalization than at baseline. So again, showing that PECS had a difference in interpretation, and participants did PECS and vocalization simultaneously. However, they did not pair the 2 modalities accurately. So what that means is they weren't vocalizing and picking the same PECS symbols at the same time. Study 2 was done to determine if children with limited verbal abilities could be taught to pair PECS with spontaneous vocalizations. And results showed that both participants made a spontaneous vocalization each time they used PECS. So there is an increase in speech within children because of PECS use. The correlation between the benefits of PECS used for children with language delay and increased verbal speech in those same children can be seen here. This brings up a great point. A lot of times parents are afraid when their children are put on devices or in programs like PECS because they feel their child may never be verbal again. But statistics again and again show that there is no correlation between a nonverbal task and a decrease in verbal speech, but rather an increase. PECS can be an effective program to assist individuals on the autism spectrum to become more effective communicators, and also for those with language delay and nonverbal speech. And depending on the needs of the child and the families, different phases and different prompting levels can be used, as well as co-programming with other devices and other language therapy styles. It shows that a child would benefit from PECS. Thank you.